Hi, this is Anna Villarreal, and welcome to the first episode of Setting the Pace. I'm here with my co-host, Kat Kuzmeskas, and we're going to be talking about blockchain and healthcare today. Kat, do you want to introduce yourself?
Sure, I'll jump in. Talk a little bit about how we came up with the name Setting the Pace. So both of us are female entrepreneurs, women-led companies. We really like to focus on and highlight women-led companies. But one of the things that we noticed when we were chatting about what to talk about in the podcast and different titles and different subjects is that we realized that we're both essentially setting the pace in our industry. So you with healthcare and specific research that you'll talk about very soon, which is really exciting, us in the healthcare and blockchain space. So we just really wanted to share with others what we're doing in the space, setting the pace, and then also highlight other women leaders in the space or those that are leading in healthcare. So really excited to be here and co-host with you. This is going to be a lot of fun. So a little bit about my background is I'm a former hospital administrator at Yale New Haven. When I was there, I realized that I wanted to move a little bit faster than hospital leadership would allow me to. In a lot of introspective research of myself and kind of asking, where do I want to go? Where do I see myself moving? It led to a career in entrepreneurship. And the jump of starting SimplyVital Health really happened when I needed a specific software, but I couldn't find it. And so that's what we built first. So background has always been in healthcare with a small stint in teaching. So I'm a Teach for America Corps member. After I did Teach for America, I got a master's in public health, and then essentially every career thereafter was the intersection between data and healthcare, serving as the liaison between either a customer or a client, and then usually the tech team.
Great, and she's done some amazing work, so we're going to jump in and ask her a few questions. And then on the next episode, you'll hear more about me, and I'll introduce myself. But right now, first question, Kat. For those of you who don't know what blockchain is, can you give a quick explanation of the technology and how it works, and then talk a little bit more about your company, SimplyVital Health?
Sure. So I always like to start with saying that blockchain is a lot less sexy than everybody talks about and how it's hyped. It really is just an audit trail. But what's great about this audit trail, or essentially just a record of information, is that it's immutable or unchangeable. And that's really important because that's never happened before in tech. And so for those of us that are in data and data analytics, having a data set that you can essentially prove has not been edited or changed is really important. There's a lot of research that you're working on. There's a lot of data that intersects with what we're doing, where making sure that that data is unchanged is kind of the crux of that research and the importance of what that research shows. So it's really just an audit trail. How it's powered really is a bunch of different computers that run the system. So that's why they call it decentralized. So instead of one computer powering the whole system, like your laptop, you can actually have a network of different computers that power the whole system. And that's really what drives the interest behind it, is that you can actually, using different blockchains and different tokens and cryptocurrency, can create self-sustaining and autonomous ecosystems in many verticals. We particularly focus on healthcare, because my background is in healthcare. And I guess the general idea of what we've created in the biggest vision is Health Nexus, which is a healthcare safe blockchain protocol. So in blockchain, a lot of people are very familiar with things like Bitcoin and the Bitcoin protocol or Ethereum. But what we've anticipated is that specifically in healthcare, those protocols are not going to work well with enterprise systems or enterprise systems that use a lot of data. And so we created one that's very, very specific to healthcare. We dubbed it the HIPAA-compatible blockchain protocol.
An enterprise, just for the layman speak, is what?
Oh, good question. So enterprise would be, from our perspective, essentially anything that's not the patient and can go really large. So really large academic medical centers, health insurance companies, even physician groups.
And so one of the things that I'm thinking of when you say blockchain, decentralized, HIPAA compliant, and healthcare, it's all about is medical records, like the big thing that you can put into this. How are you implementing it right now?
Yeah, that's a great question. So I love that everybody goes straight to electronic medical records, because we all know that there's such an issue with the access of data of electronic medical records. And EMRs, or electronic medical records, were really started from paper. We all had paper records, and then they transition that model into a system, a technological system. And so that's a very siloed system in healthcare and creates data silos. So one of the ways that we've really focused on the infrastructure is what we call a key pair system, which is just a username and a password that essentially will help break down those silos and those electronic medical records of the patients, where your data could sit in a physician, your primary care physician's office, but then you also have information with your OB-GYN, and then you also have information with your general surgeon. And with a key pair system, you can actually open up access to all of those. So everything that we focus on as a company is data access. When you look at the cost of healthcare, the issues in healthcare, a lot of it can be boiled down to just getting that data. And so we wanted to make sure that that was the baseline infrastructure that we created.
Which I'm sure every listener can appreciate, that when you go to different doctors, your data is not following you typically, and you have to manually send your medical records or release them.
Yeah.
So that's pretty cool. How did you first hear about blockchain?
Yeah, so it's funny because I actually heard about blockchain before cryptocurrency, before Bitcoin. So there's a funny story with that. But I heard about blockchain because it was in May 2015 when I had decided that I wanted to become an entrepreneur. And so I just started problem finding in healthcare.
So since then, when was blockchain? Was blockchain a thing when? So before 2015, or
yes.
was it new then? Okay.
Oh, it was before then. So those are like they're like crypto anarchists that you can say that were like around from the very beginning. And like, then even if you break down blockchain to a super technical standpoint, which I would let Lucas do at any point.
Lucas is her co-founder, yes. By the way.
Technical genius. Really, it's based on fundamental aspects that have been around for a really long time. So cryptography, you can trace back to Egypt. And so it's really brought together for the first time in early 2000s, late 2000, like 2010-ish. And then I feel like it started to hit popularity in 2013 with the early adopters. So 2015, and I was already behind the early adopters. And then I think healthcare really started to come on board. I would say right now, like in 2018, I'm starting to hear that people are okay with blockchain, and we can actually talk about blockchain now because it's super taboo before.
And people might understand what you're saying.
Yes. You mean Bitcoin?
Yeah.
Yes. So I heard about blockchain because I was problem finding in healthcare. So I was reading a lot. I was reading a lot and also talking to potential customers. And in that process of reading, blockchain fell into my lap and I couldn't get away from it. So it came in through LinkedIn, through email, newsletters, anything that I found on the internet. And then when I started to realize the frequency that it came across my inbox or LinkedIn, I started to think that this might be something we want to focus on. This could be a game changer in all industries if it's implemented in the right way. Still not a sexy technology. It's very basic, but it can do many things in its basic way. And so I made the very specific decision. Once I heard about it, realized it was probably going to be a big thing, I read everything I could about blockchain. If there's a white paper, a textbook, a podcast, any sort of video, like I just dove right in, the rabbit hole, as they call it. And so it really was right around that time. I would actually say, so problem finding entrepreneur started in 2015, about a year after that. So 2016 is when I really started to dive in.
So you've been able to speak about it well. And so it seems clear, because when you say blockchain, it is kind of scary to the layman. Mm-hmm. So what unique challenges does the blockchain and the healthcare industries have that, when you talked about problem finding, what does that bring as a solution, but also what has been your challenges in talking about blockchain and trying to merge it with healthcare?
Yeah, so many. So earlier when I mentioned that like it's 2018 and we're just now able to talk about blockchain, I would say the earliest challenges with blockchain was being able to say the word, because blockchain, I feel like up until now, has been so tightly connected to Silk Road, which was an illegal black market for illegal drugs. And you could use Bitcoin for that because at that time it was virtually untraceable. At this point, we now know that if you have a wallet, we can actually trace back the transactions to you. So it's not quite as anonymous as everybody thought. But up until now, blockchain has just been so tightly connected to to Bitcoin, which is connected to Silk Road, that we haven't been able to talk about it. But with this ledger in healthcare, the challenges that it can solve are many. Really, our focus as a company is around data access. And since we are a protocol like Ethereum, which basically means kind of like the internet, anybody can build on it. We have over 20 companies that are currently building on in different stages of development on the protocol. And it's everything from tracking opioid prescriptions within the state, working with the Department of Public Health. We have a company that's doing that. Not we, the protocol. It's open source. There's another company that's also tracking opioid prescription, but across state lines because those databases are state bound. We have a physician that is a transplant physician, a pediatric transplant physician, and he is using the protocol and blockchain technology to streamline the process for a pediatric patient to gain access to their anti-rejection medication. So in transplant, as you know, but for the audience, you get an organ that's not yours, and so your body immediately tries to reject it, and so that patient has to be on medication for the rest of their life. So if that pediatric patient, for whatever reason, can't get access to their medication, then their body will immediately try to reject it. So using his platform and blockchain, he's been able to streamline that. So in just those three examples, it's all around data access.
Yeah, we could do an entire podcast on just that because it sounds like it solves a ton of really big issues going on right now, especially with the opioid crisis.
Right.
And so also just to kind of bring some of the listeners up to speed, so you've said Health Nexus is HIPAA compatible. What does that mean for providers considering using your platform, your protocol?
Yeah, so we chose HIPAA. So it essentially what it does is it just brings a level of security that healthcare is comfortable with. Right now with the protocols, Ethereum and Bitcoin, they are very secure in a decentralized nature description in that you don't know where those servers sit. But in healthcare, not knowing where those servers sit feels very unsafe. So what we did instead is our network is powered by HIPAA compatible computers. And what that means is we have a certain standard of HIPAA compliance that each person who runs the network has to attain and maintain. If you don't maintain HIPAA compliance, then you don't get to power the network. And so that allows any entrepreneur who's using the platform or the marketplace to actually say, I know where these servers sit. We've done what we call Know Your Customer KYC, so we actually know where they are and they're in a location that's safe. In banking, it's called KYC. There are certain countries where you can't do business with those countries, and it's important that we follow those same standards in cryptocurrency and blockchain. So it allows us to do a certain level of know your customer, but then also we know that there's a certain level of security with their computer. And it's not that, so the data is not stored on their computer. The data sits in existing silos or, however that data is moving around. It's more just like to be able to say that this computer is secure in a way that we're comfortable with.
Yeah. And it sounds like from HIPAA compliancy that the integration of your technology is a lot easier when you meet protocols that the industry recognizes.
Exactly.
So then there's been a lot of industry lingo used. You've done a great job of trying to explain what each term that you've used is. But let's walk through some examples of what people are using your technology for. And you talked a little bit about the opioid crisis. And people are using it to track different opioid prescriptions. But you mentioned your data marketplace. What's the difference between the data marketplace and Health Nexus? Let's give a real life example of how things have sort of worked out.
Yeah, so Health Nexus is the protocol, so kind of like the internet. And then the marketplace would be like a web-based app like an Amazon or an Etsy. So one thing, the marketplace came out of people in the industry asking for it as a solution, which is really cool.
So give me an example of a person. They can remain anonymous, or the company, but what they asked when they said, hey, do you have like an Amazon or an Etsy?
Yeah, so can I say?
We can talk about my company. I couldn't lead any more into this.
So the way that Anna and I met is she reached out to learn more about the marketplace that we're building. And essentially what the marketplace is it's a very secure, HIPAA compliant way to buy, sell, and share healthcare data. So companies like Anna's have a very important data set that can provide a significant amount of insights to researchers, to graduate students, to physicians, essentially many people that sit outside of that data silo. And with the marketplace, what Anna's company is able to do is they can, with patient consent, they can actually upload the data to the marketplace and essentially create a gig economy around healthcare data. So depending on the state of the data, people can offer their services to clean it, they can tag it, they can analyze it, They can combine it with other data sets to find any sort of correlations or causations. So there's a lot that can be done with the data. And we didn't even know that this was a thing. Like, I knew that there were clearinghouses that sold data, but I didn't know that there was such an interest from entrepreneurs, from physicians, from nonprofit groups that wanted to open up access to their data for others to be able to gain insights from it.
Yeah, and it seems like, from my perspective, we're doing all of this great work and we have this cohort of patients that, we've spent a lot of time gathering. So to be able to put them into one centralized forum is really cool. And so when I look at it from a healthcare perspective, I'm seeing it from the research that we're doing as a company, but I know that we're a pilot group, and I think you have a couple others lined up. And so can you talk about any of them in terms of more examples? Initially, I think about rare disease. That research is extremely important, and those patients are also really hard to find because it's rare. So have you done anything with that?
Yeah, so we actually have a physician from a leading university she leads a consortium on rare diseases. So it's a national consortium of physicians from different academic medical centers, which is essentially just a teaching hospital where physicians go and do fellowship and residency post medical school and lots of research. But they created this consortium of rare disease because these patients were so hard to find. She shared some rare diseases that I had never even heard of, where the patient size, the number of patients in the nation that have this rare disease are literally 15 or 20 or 35. So it's such a small cohort, but that is a very important cohort to study. And historically, that data has sat in silos, not accessible to anybody else in the research community or any physicians that might have a patient that comes through with that same rare disease. And so the marketplace opens up this opportunity for them to open up access to that data. So there's been a lot of interest around that. We had a conversation with a group in Mexico. He's a physician and a technologist, and he's really interested in the same thing. He talked about the delay in technology and advancement in healthcare in Mexico and how they as a company are interested in speeding up or setting the pace of that innovation as much as possible. So what they would love to do is to gain access to, and they would pay for it, but access to de-identified data in the States to see if there's some innovations that they can speed up in Mexico. And so it also breaks down the barriers across countries. And obviously this is done in a very HIPAA compliant way. It's usually followed by patient consent. It is followed by patient consent. So we've been very thoughtful in how we've put it together and trying to open up this data for others to use.
So this brings up two questions, and I'll say them both so I don't forget them. But the first is, how did that physician in Mexico find you? I'm fascinated to hear how you've been able to spread the word on your company. But then also I'm thinking about FDAs and if you've had any interaction with the U.S. FDA and any equivalent FDAs from around the world.
So the company in Mexico found us similar to how you found us, which is just online presence.
Yeah, and a need for somewhere to put our data.
Yeah, and they just reached out randomly. And it's a fascinating company because they actually focus on the supply chain of sterilization rooms and tools. So it's very specific. But they were also looking for a solution, innovative. So they stumbled on blockchain, then they found us, and then they learned about the marketplace. So it's really just having that online presence. And then in terms of conversations with the US FDA and other FDAs, we actually haven't had those conversations. We do watch a lot of other regulations pretty closely. So securities regulations, we also are very familiar with HIPAA because we're a HIPAA compliant company. And we're very familiar with other things like GDPR. So GDPR is a privacy regulation is it the EU? I think the European Union. But anyway, we've had to follow that pretty closely because as a company, we have to be HIPAA and GDPR compliant. So one thing that we talk about with people that are coming through is, yes, the protocol is HIPAA compatible, but your application or the marketplace does need to be compliant with regulations in that country. So as we grow and expand and as data sets are available across the world, we do need to make sure that we're compliant with those certain regulations.
And then let's talk just a little bit about, if I'm thinking about users, how the data marketplace, so this physician in Mexico, for instance, has a need for de-identified data. What does he do? Does he put his parameters into the Etsy search bar that you have set up? So talk to me just a little bit about the usability of it.
Yeah, a lot of conversations on how we based it. It was helpful talking to you about what you were looking for in terms of data access and opening up data access, and then also definitely taking from the Etsy model. More so that, I mean, you can look at a lot of online stores to get ideas of creating a marketplace. So we actually looked pretty heavily at Amazon and Etsy, but selected more of the Etsy model because we feel like that growth is more organic, it's more personal, it's companies that are coming to this place to connect with others. So if the physician from Mexico was looking for a data set, he would actually go to a search bar. And just like you would search for, so let's say he is looking for sex-specific data. So he could actually type in, so I'm looking for female-specific data in this age range, and you can actually create different filters for finding data sets that you need or that you're interested in. For rare disease data sets, you could type the actual disease into the search bar. So just like Google is extremely searchable, Etsy and Amazon, really that entry point is that search bar.
And so it sounds like and I'm wondering if you have any analogies that you can pull that are, that are more well known in sort of the world, but in terms of, it sounds like what you're doing is really going to accelerate innovation, especially if you have these rare diseases that are able to be searched and then the data is able to be shared. Mm-hmm. Do you liken yourself to another industry that was kind of at the forefront and has accelerated beyond compare?
So I think there are a couple of companies that come to mind, and also companies that were established before regulations existed.
So set the pace.
Yeah, set the pace. So a company that comes to mind is, I would actually say it's more of a Google that comes to mind, mm-hmm. Just because they really started as a search company and essentially moved beyond. They created something before the general public realized that they actually needed it. At least when I came onto Google as a wee child, mm-hmm. And I feel like with the marketplace, as we continue to talk more about the marketplace, people in healthcare specifically say, why hasn't this existed before? And we really like having that conversation is we want the marketplace to be top of mind eventually in 5 to 10 years, where people look back and say, I can't believe that this never existed before.
And so this is a very interesting topic because I get that a lot as well, on why this hasn't existed before. So what is you're not allowed to have more than 1 or 2 sentences. What is your 1 or 2 sentences to answer why this hasn't existed before?
I really think that this hasn't existed before because, one, nobody knew that healthcare data was being sold, and that's becoming more known by patients, mm-hmm. specifically that our data is getting sold, and we didn't know about it. And yes, we signed those forms, so we didn't know that's what we were signing. And I attribute a lot of that awareness actually to Google and Facebook. So their freemium models, everybody's realizing that freemium is not really free, in that Google is actually taking a lot of your data. So is, all the big giants, Amazon, and Facebook. With the most recent Cambridge Analytica scandal that came out, there was a lot of clamor and conversation about what really happens to your data, and that healthcare is always behind. And so now everyone's starting to realize that happens with healthcare data as well. But the second reason is I really do attribute it to blockchain technology, in that we've never been able to do this before with a technology where having that key pair system or that specific user access is trackable in an immutable way. So you as a patient, if you feel comfortable, you can put up your data set and you can actually see where that data set goes in an immutable way. And I keep focusing on the immutability piece of it because I'm always taken back to the Edward Snowden story. And Edward Snowden is the guy who put all of the US documents on WikiLeaks, and he deleted his tracks in the server, which means that to this day, I've heard that they still haven't found all the documents that he leaked. But if that data set was backed up to blockchain, an immutable ledger, he could have been able to delete it, but it would have been stored somewhere else. And so the immutability is really important because healthcare data it's much different than social media data. I want to know where my healthcare data is going, and it's probably in places that I didn't know actually existed. And so I think it's really both of those.
So it's like almost
not
like
1 to 2 sentences.
Yeah, that was definitely not. So we're gonna, for the next podcast, she's gonna work on this, and we're gonna come back to it. So it sounds like, though, you're creating some transparency for the actual owner of the data,
Yeah.
so that they know where it's going. And I think that that's important as a woman-led business, where we're trying to drive innovation within healthcare. I think the value proposition of it being about the users, rather than just the dollar signs, because everybody knows that follows,
Right.
Which is a huge thing for me, which is why we wanted to use your marketplace, because we want the patients to be able to have some transparency. So is there anything else that you want to cover, you want to elaborate on?
All good. All good.
All right.
This is I am so excited about our partnership and co-hosting, and I just setting the pace. Like we've got a lot of ground to cover, and we're both moving so fast and really leading the industry, so it's exciting.
Yeah, I agree with all of that. And with setting the pace, it's nice that you have a pulse on the regulations that are going on, so that you can be involved in them, and hopefully set some of your own.
Yes.
So very cool. Well, thank you for joining me, and look forward to seeing you soon.
Yes. Awesome.